Hello, everybody, and welcome. Thank you, Patricia, for having me. Thank you, Chad, for all the help you're giving in this work that we're doing today. And I'm seeing names from all over the world, and I like that. Okay, let me tell you that at Vinland we have worked with people from all around the world. Well, not all around, but yes, from Asia, from Africa, from Europe, from America. And I will try to make this so that you will all feel included as much with examples from all around the world so that you can see things from your perspective, okay? And let me tell you a little bit about what we're gonna do. I'm gonna start sharing my presentation. Just give me a second, please. Oh my, where did it go? Here it is. Can you see this or not? Yes, I think you can, right? Yes, can you see the presentation?
It looks good, Anna.
Okay, thank you very much. So today, well, this is the introduction. I'm going to introduce myself a little bit more. Then we're going to talk about some definitions that we're going to be talking about during the whole workshop. And then we're going to have a little discussion in small groups so that you among yourselves can talk about how to prevent, mitigate, and or mitigate the circumstances and the impact of the things you do as journalists. Then we're going to have a small recess of 10 minutes, and then we are going to start talking really about safety. What is, how to make a psychological safety plan, and we're going to do our own exercise on creating our own general personal psychological safety plan. Okay. At Vinland, we started working with journalists like 18 years ago now. Because the International Committee of the Red Cross, before that, we worked mostly in natural disasters, but we started also working with the Committee of the International Red Cross in some areas of disruption because of man-made disasters like war and things like that, okay? And it was the International Committee who asked us to give a workshop to Article 19, which is also one of the organizations that work in the protection of journalists. And the state of the Mexican, it was for Mexican journalists, the state of the emotional state of the Mexican journalists was so bad, because at that time, it was still happening, but at that time is when it started really being rough in Mexico for all of them. Many of them were being killed. Many of them were being forced to relocate to another country because their lives were at risk. And it was really tough. So we told Article 19 that we wanted to work with them to do something about this. So we told them, you can pay us whatever you can, it doesn't matter. And we'll give them 9 to 12 sessions for the PTSD and the acute stress and things like that. And then if the journalist wants to stay in therapy for longer because they have other issues, they can stay and they're going to pay whatever they can. And we still work like that because as we work in so many different parts of the world, we couldn't put a fee for everybody the same. So we better just let the journalists, the people we work with, the patients, decide how much they are going to pay for their sessions. And this has worked very well because obviously it's not the same for someone who's in Cuba that for someone is in Kenya or someone that is in Iran or someone that is in India or someone is in the UK or in the United States or in Canada. It's very different, the situation and the financial and the economical possibilities they have. So that's basically the work we do. And what we do, aside from giving workshops and doing guides and things like that, we also work mostly giving therapy to those who, because of the job they do, they present symptoms of acute stress or moral injury or vicarious trauma, or in many cases also, unfortunately, PTSD, post-traumatic stress disorder, because they've lived violence indirectly as victims, and they start presenting symptoms of PTSD. So let's start talking about the subject today. And unfortunately, we need to talk about violence, because violence is what brings us here today, to be safe from it, and to do the coverage, whether you are a journalist or a photojournalist, to do a coverage that is safe for you in all senses, okay? And the reason you need to be safe is because journalists are being targeted all over the world, because you tell the stories that others don't want people to know about, because you present to the world the crooked things, the lies, the killings, or all of the or the money stealing, or the things that politicians or organized crime groups are doing. And obviously they don't want you to speak. And the more you do a good job, the more you're going to be targeted, whether if it's directly or online, but it means you're doing a good job. And for the World Health Organization, violence is the intentional use of physical force or power, threatened or actual, against one's self, another person, or against a group or community that either result in or has a high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. And I like this definition because it includes something that we many times don't think about, and that it can be done to one's self. I've seen a lot of journalists throughout these 18 years. I've worked with a lot of journalists throughout these 18 years. And one thing that not all of you, but many of you have in common is that you don't take good care of yourselves. You are so prompt to help others, so prompt to focus in helping the world, helping the other persons, but you are not as equally prompt to help yourself, to keep yourself safe, to keep yourself in a good place. And that's because you have this personality that is common to all first responders. We psychologists, as first responders in natural or man-made disasters in Vinland, we also have that personality, okay? But we have learned to see it and manage it so that we can be okay. So partially, it's important for us to know how to be safe. That's the first step. And what we can do to manage our emotions, to manage the things that are happening to us because of the work we're doing. When you see violence in real time, in real life, as journalists, you're taking the photo, you're interviewing the victims. You become secondary victims of that violence. That's called vicarious trauma, okay? And that secondary victimization that we do, because we also do it in Vinland with the psychologists that work with violence, we also do it when we hear the stories of the victims, has a toll on us. I've heard so many times from many journalists saying, but I cannot respond, I cannot feel, I have to stay cool and safe and not having emotions. And yes, it's true. When we are working, when you are working, when you're doing a story, you have to keep calm. You cannot outburst in crying with a victim of whatever you are covering. You have to be detached a little bit about the situation. But once you get home, you are back to be a regular human being. And a regular human being is impacted by the things they see, they hear, they smell, especially when they are because of violence. So once you get home, you need to let yourselves feel, okay? We'll talk a little bit more about this at the end, in the last part of the presentation. We're also going to be talking of one of the things that is happening today a lot, that is online abuse. And again, hold a second, it's just that I want to change, but I can't. Okay. Online abuse is a behavior that is threatening, and it's done to harass or humiliate, humiliation, to provoke humiliation to one person. And I love the Pan-American online harassment definition that they give, that is a pervasive or severe to individual or group through harmful behavior. And I have to look for pervasive, since my first language is Spanish. I am always learning new words in English, obviously, also in Spanish, but I'm always learning new words. And I love the word. I really fell in love with this word. Spread throughout so thoroughly as to be seen or felt everywhere. And yes, online abuse, sometimes people say, well, it's just online, but it's not true. Someone who's been targeted online feels it's everywhere. It spreads in all their lives. It spreads in all the spheres, the different spheres of our lives. When you're online abuse, when you're being targeted with online abuse, you're afraid because you don't know how big the threat can get. If it's just a troll, and I say just a troll when it's just someone that wants the notoriety you want and is attacking you so that everybody looks at him or her and says, oh, yeah, that person is saying things, you know, because they want to be in your place, because they're envious of you. But it can also be a country targeting. This, for example, I've seen patients in Iran that are being targeted online by their government. And the Iran government has this capacity, they're capable of getting everywhere. And they have this machinery that makes it so that it's devastating, really devastating. And you don't know how far they can go. You don't know how far these threats can become a real threat to your life. So you start not seeing your friends because you feel you're putting them at risk. You start not seeing your family because you feel that you are putting them at risk. You start isolating. You start not working as much because you cannot post as many things on the online because you have to go offline a little bit because of this situation. And I always say that online abuse is a kind of dead. The way it's perceived, it's not such, but the way it's perceived is like a death of the journalists themselves. It's like you cannot exercise your profession the way you used to. Okay, so it feels really, really strongly. But I would like to focus ourselves in how to prevent, respond, or mitigate. And I want to make this distinction, and this is from the International Federation of the Red Cross. The International Federation is in charge of natural disasters, and this is a concept that comes from natural disasters. But I love that they have this this manual that is for violence, how to prevent, respond, and mitigate violence in different countries, because they also see that. And to bring this to the table, to bring these concepts to the table of discussion with journalists about the violence they're living, I love this because it's not the same. And I want to make the distinction between prevention, response, and mitigation. We are mostly responding to violence, and responding is an action or intervention to cope with and handle the violence after it occurred. And we have become responders of violence in the world. But as violence has grown, as violence has become more persuasive, more insidious in many countries, I would say in all countries, we need to start thinking more in prevention and mitigation, because that's the way we're going to stop this growing of violence in general. And prevention means to avoid violence from occurring in the first place. That's the way, that's the ideal, let's say, to stop it from happening. But we know, and I am conscious, that as journalists, as I said, if you're doing a good job, you're not going to be able to prevent it 100%. You're going to be targeted, or you are going to be in situations, for example, if you're covering war, or you're covering a manifestation, or you're covering something that can become volatile, and it can become aggressive, and it can become guns and people punching each other, you are going to be in a situation of violence. And that's something you cannot stop from happening always. So I think that the focus should be on mitigation. And that means decreasing further risk of violence and reducing the impact when it does occur. And we are going to be focusing on mitigation today, on how to reduce the impact that it has on you.